everybody, and welcome to The Balancing Act. I'm Julie Moran.
And I'm Olga Villaverdi. Today, it's all about our health.
That's right. We're learning more about the pain that can occur after shingles.
Plus, new ways to help detect and thus determine course of treatment for prostate cancer.
And The Balancing Act starts right now.
Prostate cancer is one of the most common types of cancer in men, affecting about 1 in 9. While prostate cancer can be cured in some men, approximately 1 in 3 men will experience what is known as recurrent prostate cancer, which is prostate cancer that has come back after initial treatment. Now, unfortunately, prostate cancer is the second leading cause of cancer death in men. About 1 in 41 will die from prostate cancer this year, and that's according to the American Cancer Society. The good news, there are newer imaging techniques that can help locate recurrent prostate cancer. Being able to locate the disease in the body can really help doctors personalize care for patients living with recurrent prostate cancer. And here to help us understand more about this is Dr. Jonathan Jay and his patient, Peter Irving. Welcome to both of you.
Thank you.
Doctor, let me start with you. This month, June, is Men's Health Month. So let's start with, let's just start with prostate cancer and what it is.
Well, we'll take a step back and start, what is the prostate? Because most people don't understand what the prostate is.
Let's do that.
The prostate's a male reproductive organ, and 1/3 of the fluid that a man sees in his ejaculation comes from the prostate. The purpose of this fluid is to nourish and protect sperm until conception.
It's treatable?
Yes, prostate cancer is treatable. Prostate cancer at its treatable stages is asymptomatic. So it's very important for men to understand that they need to have a evaluation on a yearly basis starting at age 50, which would entail a rectal examination and a blood test called PSA.
All right, so let's bring in Peter. When were you diagnosed? What happened?
2008, diagnosed with cancer following a needle biopsy, which 12 out of 13 were positive.
So you were doing a routine exam, Peter?
Just routine. And the PSA started to spike over a period of months.
From what to what?
My normal was somewhere in 1.5, let's say, and this kept creeping up, and I think my general practitioner sent me to urologist when it got to like 4.5.
Okay.
But at that time, they still did not believe I had prostate cancer. It just, things just weren't what they thought they should be. That's why I went to the urologist, and then I had the needle biopsy.
Which confirmed it?
Which confirmed it, and then I went and had surgery, had it removed, and followed with the same urologist.
To be checked?
Yeah.
All right. Doctor, let me bring you in. If you could define PSA for us, please, and inform us of the levels that happen.
PSA stands for prostate-specific antigen. It's a protein that's excreted solely by the prostate. So it's a great way of monitoring whether a patient has prostate cancer, develops prostate cancer, or has reoccurrence of prostate cancer. The significance of PSA is what the PSA is in an individual. In Peter's case, his PSA was 1 and increasing over time. That was indicative that something was changing and something was wrong.
Understood. So, Peter, you have the surgery, you're living your life, and then you have recurrent prostate cancer?
Well, my PSA started to spike again. You know, in theory, you shouldn't have any PSA.
Exactly.
And I believe it was somewhere again in the 1s, and then it kept rebounding and going up, and we watched it for 4 years. 2016, they decided to do radiation therapy and hormone therapy together. And they concentrated on the spot they found through the new imaging, and today I'm 0.
That's fantastic. Doctor, since he mentioned the new imaging, it's a PET CT imaging test. Tell me what is different from this test as opposed to what is always used, I guess, in a bone scan and CT, right?
Yes.
So what are the differences between what was used then and what he used?
So we had to define the location and extent of this disease. So conventionally, how do we do that? CT scan is a test that has the ability to survey the body without making an incision. We can survey the body for soft tissue changes. We can detect enlarged lymph nodes. We can detect masses within the abdominal cavity. Bone scan surveys the bone for reoccurring disease. Now think of this. With these conventional tests, you have to have a mass. A mass would be hundreds of thousands or millions of cells in one place to be detected by these conventional studies. This newer CT PET scan has the ability to define the location and extent of prostate cancer, reoccurring prostate cancer, at an earlier stage and at a lower PSA.
And how does that make a difference then for the treatment?
It's very important because we want to treat disease. We need to define the extent and location of the disease. That dictates our treatment options.
So as opposed to, let's say, affecting other organs in the body, you're minimizing the effects.
Absolutely. In Peter's case, we were able to do a CT PET scan, localize the reoccurrence to one area within the pelvis. We were able to treat that. But we treated that with radiation and hormonal therapy. We were able to treat that without affecting any of the other organs around it.
Peter, you're doing fine now, right? Everything is controlled?
A negative PSA
Fantastic.
test for two plus years.
So for our viewers out there, and we have lots of males, what would you say? What would be your final thoughts, your words of wisdom?
Just have a probably at the age 45, doctor.
45, 50, yes.
Yeah, start getting your PSAs on a yearly basis, and it'll make you feel much better.
Absolutely.
I mean, you know, not worrying about that.
Doctor, any final takeaways?
One of the important things is that prostate cancer is prevalent within our community, yes, but if found early, it's a treatable medical condition. And all you have to do is a simple rectal examination and a blood test called PSA with your primary care physician.
If something were to happen again in the future, would you suggest again this new imaging test to him?
Absolutely. If we saw increasing PSAs, the first thing that I would do is this new CT PET scan.
All right. Thank you so much, gentlemen, both of you, for your time. Thank you. I'm glad you're doing fantastic. And of course, if you'd like more information on this new test, the PET CT imaging test, go to this website, bcrprostatecancerimaging.com. That's bcrprostatecancerimaging.com, or just check out our website, balancingact.com.
Typical day, we're on our phones, laptops, tablets, watching TV, playing video games, and more. But do you ever notice when you're on a device for a while, your eyes feel tired, dry, irritated, or blurry?
I'm an editor and motion graphics designer here at a production facility. A typical day requires me to stare at monitors about 8 or 9 hours a day. A lot of times my eyes get very irritated and strained, and I find myself taking a lot of breaks because of that. And then at night, when my wife asks me to watch a movie or binge one of our shows, my eyes are fried, and so am I.
Ever heard of FryEye? It's exactly what it sounds like. Your eyes are fried. It happens when we're exposed to too much blue light from digital screens and artificial light, as well as sunlight and UV rays. And it can cause a lot of uncomfortable effects on our eyes.
Life is so busy. I have a 9-year-old daughter who is full of energy. And after a long day of work and school, the only way I can get stuff done though is by putting a game or a show on her tablet. I know it's not ideal, but hey, sometimes it's necessary.
Protect before you correct. It's so important that while children's eyes are developing, to protect them. Children are especially vulnerable, and because smartphones, computers, and tablets are a regular part of kids' lives, they need blue light protection more than ever. Even if you're older or already wear glasses, it's still important to try and prevent further harm and the side effects from FryEye.
So I just graduated dental school about 2 years ago, just working and getting used to the daily grind. When I game for long periods of time, I tend to lock in for a while and play for hours on end, and my eyes will definitely get tired. They kind of dry, you start getting a little blurry, and I just feel tired.
Digital devices are not going anywhere. So how do we fix this? Well, there's good news. It's called Blokz by Zenni, a cure for FryEye. Blokz are a line of protective lenses from online eyewear retailer Zenni. They are virtually clear lenses made with special blue light polymers that block blue light and UV rays from passing through the lens. It's incorporated into the lens material, which means the blue blocking protection won't chip or wear away.
I'm the operations director where Omar works, and I've been working with him for about 3 years now, and he's constantly complaining that his eyes have been hurting him. He has to take lots of breaks. I've been wearing these Blokz by Zennis for a while now, and I went ahead and ordered you a pair.
Thanks, bro. Appreciate it.
I heard about these glasses called Blokz from Zenni, so I ordered Julie a pair. And we like to match, so I decided to get myself a pair too.
When you log on to order your Zenni frames, just add Blokz during your order process. They're available in prescription and non-prescription, and there's over 2,500 styles to choose from.
Actually, you can upload like a photo online and like try them on digitally, so you can feel a little more confident about what you're buying. When I'm on my phone, when I'm playing video games, you know, watching movies, whatever I'm doing to relax on the weekend, it's just, there's a noticeable difference.
And thanks to Zenni, our eyes are protected. For fashionable lenses that can block blue light and UV rays, check out Zenni.com, and you can always visit our website, thebalancingact.com.
Feel like you have a barbed wire tighten on your skin, and it's like this.
Shingles affects an estimated 1 million people in the United States each year, and the coinciding rash is known to cause severe discomfort. For most people, when the rash leaves, the pain goes with it, but for some, the pain persists long after their skin has cleared. It's called Postherpetic Neuralgia, or PHN, and it develops as a result of nerve damage that occurs during the shingles outbreak. PHN affects about 10 to 15% of people, and the risk increases with age. Here at NYU Langone Health, Dr. Christopher Garibo treats a variety of patients with chronic pain, and for those with PHN, the road to relief can often be a long one.
The patient that's most likely to get PHN or postherpetic neuralgia is a patient that's been poorly treated during the acute phase of the disease. So during the acute herpes zoster, if they are not bringing their pain under control through an antiviral therapy, through good medical management, and through good pain control, they're going to damage that nerve during that time. Those symptoms correlate to the distribution of a nerve. So that could be any of the nerves that comes out from the spinal cord, I would say from the face to the toes. But most of the time it occurs in the chest, what we call the thoracic area or the abdominal area. It's something that is disabling, and the symptoms that the patient feels is the sharp stabbing, burning, non-positional, non-activity related pain that's there no matter what. You can't come off the pain.
In 2014, Arissa came down with a painful case of shingles. She never expected that the pain would return even after the rash went away.
The pain is kind of on the surface. It's hurt to the touch sometimes, but when it is really painful, it feels like you have a barbed wire tighten on your skin, and it's like this. It's been 5 years, but after the rash, I still have the pain. First, I thought the pain would go away soon. It never went away, and the pain is more intense, actually, than the rash itself. And it's just there every day.
For some people, PHN can be difficult to manage and often takes a combination of treatments to reduce the pain.
For the pain, I have medication. Doctor prescribed me nerve pain medication. It didn't help, so I look outside. I try essential oil, but no matter what I use, it doesn't make it go away.
So treatment of postherpetic neuralgia starts with patient education and expectation setting, and telling the patient about the different types of medications that are available to treat the different pains that patients with PHN are experiencing. There are medications that are systemic, so what I mean by that is medications that are taken orally. So that can range anywhere from anticonvulsants, antidepressants, to opioids. Then there are also peripheral medications, such as topical delivery systems that are available. Most of them are in the form of patches that go directly on the skin over the area that is painful. And what that category aims to do is that they dial down the sensitivity of the peripheral nervous system. So the nerves that are causing the pain at the periphery, let's say at the chest wall, that are producing all that nerve sensitivity and burning and electrical sensations are quieted down directly. And as that quiets down, the spinal cord also secondarily quiets down as well. So that can be effective as well. Very safe, probably much safer than anything systemic, such as opioids or anticonvulsants, and do not need to be titrated to effect.
For patients with long-term chronic pain due to PHN, having non-invasive options for patients' relief is paramount. Dr. Garibo explains.
So with any medication category, obviously we're focusing on efficacy and safety, but there's also tolerability as well as practicality there as well. So when it comes to, for example, prescribing opioids, they are quite efficacious. There's safety concerns, tolerability concerns, there are dependency concerns, and so on and so forth. So it may be appropriate in a very small subset, but generally speaking, they're not in a great subset. Patches are definitely the safest category. They can be effective for a whole range of intensities of neuropathic pain, of postherpetic neuralgia. The contraindications for them is if the patient is allergic to lidocaine or to the components that are used for the adhesion of the patch. But generally speaking, they're well tolerated and there's good patient acceptance towards the patch because they tend to provide cleaner pain relief.
Some patients have reported adhesion problems with traditional over-the-counter or other prescription patches, leaving some patients still looking for relief.
I tried different patches, but it doesn't stay long. It doesn't stay on, it peel off too quickly. So I stopped using that too.
So the biggest difficulty that we've had with lidocaine delivery systems is the fact that many of them do not stick well. Patient constantly has to sort of adjust the patch, re-stick the patch, press on the patch so that it stays on the body. And they tend to give up on it after a while because it just tends to be frustrating, it tends to interfere with the patient's day, and at some point they just give up on the technology.
ZT Lido uses an advanced adhesion technology to optimize the delivery of lidocaine for patients suffering from post-shingles pain and is up to 3 times more adhesive versus some generic lidocaine patches and is proven to remain in place for a full 12 hours, even during moderate exercise.
So the lidocaine delivery systems in the marketplace vary in terms of the duration that they're applied, but generally speaking, they're 12 hours on, 12 hours off, up to 3 patches a day. So the end point is really having the patch stay on, not so much how much lidocaine is in the patch, but how efficient is the delivery system and how good is the adhesive qualities of the patch and how flexible is the patch so that it can stay on.
ZT Lido provides more efficient lidocaine delivery than 5% patches over a full 12 hours by using less total drug to deliver the same amount of lidocaine. Topical lidocaine systems are now being recommended as a first-line treatment for the relief of pain associated with PHN.
So my doctor recently prescribed me ZT Lido patch, and I find that it stays on longer, and it does help me throughout the day with the pain.
If you do happen to get the virus reactivating and it causes extensive nerve damage, and now you're left with neuropathic pain of postherpetic neuralgia, tell your doctor about the pattern of the pain. Is the pain constant? Is it intermittent? What is the character of the pain? What is the effect on your social life, on your occupation? Give them an understanding of the magnitude that the pain has on your lifestyle. And that's extremely important because the end point for the physician is to ultimately improve your function in a way that's clean and effective.
For more information on ZT Lido lidocaine topical system, go to this website, ztlido.com, or check out our website, thebalancingact.com.
Such great and valuable information.
Really good information on today's show. And remember to head to our Facebook page and our website and follow us on Twitter.
Don't forget our Instagram, that's @Julie and Olga. That would be
Julie and Olga. Thanks for watching, everybody. We'll see you next time. So long.